Good afternoon. I never expected to be delivering this last lecture in the Death and Dying course from any place other than in front of you. However, some health conditions in the last 3 weeks are preventing me from being there with you.
By the way, I'd say, where is Jim? When's he coming? Sitting here in his office, that's what comes to mind, and I know it's the grieving process is you look for the person and then realize, oh no, they're not coming, they're not going to be here.
I have an image of Jim in my mind. It is his smile, his beaming presence, his laugh.
Qualities that Jim really looked for in people were humor, initiative, compassion.
Very creative mind, masterful multitasker.
My first impression of him was that he was too good to be true.
I don't know of anyone who acted on a commitment to outreach education in more ways and with greater scope than Jim.
You know, I sat on admissions committees where I would read the students' essays of why they wanted to go into public health, and so many of them mentioned taking Jim's courses and giving that as a reason for wanting to pursue a career in public health.
Once I returned to the University of Minnesota as a faculty member and expressed to Jim and others my interest in teaching undergraduates, he took me under his wing immediately, without hesitation. It was as if he welcomed back one of his own.
I am who I am today. I have the career that I have today, largely because of Jim.
To serve means to consider and even put first others.
It means to not put yourself first, to put other people first, and to leave the world a better place than it would have been if you hadn't been so passionate and committed.
What an amazing thing for him to be able to leave this legacy behind and to continue to touch the lives of thousands and thousands and thousands of students.
He wanted to make things better for people, and he wanted to share knowledge. And I think for that reason he tackled subjects that were taboo, sex, drugs, and death. Talking about them is the first step. Jim contributed a lot of information and research on these topics as well, but he wanted to make things better.
When I told my mom that Jim had passed away, she was very, very saddened. She attributes the fact that I'm still sober today and that I'm doing what I'm doing to the fact that Jim got involved in my life. If I'm any example of all the others he influenced, then he's had a huge influence in the recovery community.
When I think about Jim and his career, hoping that I, along with my other colleagues, can have a career such as his where we touch so many people's lives, if we can say that we did that, that's a pretty good life. And so, you know, I guess I would like to say thank you, Jim.
Yeah, if there was one thing that I could say to him, it would be thank you. I feel like I'm in the place that I'm in, and I know myself so much better than I ever did before. And I love what I'm doing, and it's in large part because of him.
Tana, I wonder if you'd be willing to say what you think Jim wanted you to become.
A Democrat.
I think I would like to share his sense of spirit. I knew all along that he had an energy field, a presence that was beyond his own existence. And I believe that that presence, that spirit, is what really carried him through and what made all of our relationships as positive as they were. And I think that presence will carry on.
Where you live is in the memory of the people who knew you.
Jim never ever put labels or stigma on people.
He was a mentor to me, somebody I really trusted.
I love Jim Rothenberger.
He was the best hire I ever made.
One of the things that I learned from Jim over the last couple of weeks of his life was he to not be afraid of death. I think the average person wouldn't have gotten out of bed in the morning with all the health issues that he had, but he never let it show because he was so passionate about what he did. I think he was extremely grateful for all that he was given, all that the U gave him, all that his friends gave him and his family. I think that's what it is, to be passionate.
A quote, "He who would live well knocks on the gates of the grave daily." Those who would live our lives to the fullest recognize on a daily basis that this may well be our last day. If this is your last day, what would you do differently? And if it's radically different than what you're doing now, ask yourself why. Good luck, good wishes, and hopefully we'll run across each other again. Thank you.